So here we're just working on over the shoulder now, just some deep effleurage strokes over the shoulder. Now I've got my left hand on the supraspinatus and my right hand on the infraspinatus, and I'm just gliding up with some strokes to the withers and then coming slightly deeper back down. So my hands are coming back down to where the scapula articulates with the humerus, and I'm gliding back up towards the withers. These are important stabilising muscles, playing a part in prevention of shoulder dislocation, etc. So then I just go sideways and I'm just cupping out that area, so just using some cupping, some deportments there. And then just drainage strokes, just moving on to the triceps. So I'm just using the back of my hand there with some deeper compression glides, stripping down through the deltoids and in towards the triceps. And again, the deltoids are tied quite closely in with the infraspinatus, and I'm just stripping through down to the triceps with these compression glides, and it's just the smooth part of the back of my fingers that I'm gliding down with nice and deeply, as much as they'll tolerate and be comfortable. And then I'm just using some light beating, just passing the muscle from side to side, in between my hands, just lightly clenched fists there, just really working through the triceps. And then effleuraging out. And I'm just having a little feel. So obviously I'd felt an area of tension there. It was quite fibrous, quite tight. So I'm just using some direct pressure, using the thumb technique. And I'm just protecting my own joints there, just putting one thumb on the back of the other one. Double thumb doesn't necessarily mean double pressure. It just means that I am protecting my own joints there and not stressing out my left hand. Just giving it some assistance with my right, and then cross fibring friction over that area where I use direct pressure. Just giving a good crisscross movement across the whole of the triceps area. Or slightly above there. And then moving over towards the withers, and I'm just having a feel through, another palpate through. Like I said earlier, we continuously treat and palpate, and it's quite a common site for adhesions and stress points through the withers, T4, T6. It's the origin site for the rhomboids and the splenius. So of course at the attachment site, the origin site, it is a common area for stress points. So I'm just squeezing through there, gliding through there, trying to work through any adhesions. I'm working quite deeply, and then I'm just doing some light deportment to close that area, working through the thoracic trapezius, cervical trapezius, and just having another palpate through just to see if I'm happy. There's obviously another hard area there. So again, I'm just using some direct pressure on this area. The horses respond really well to work around the withers. Just keeping an eye on the horse's responses as I'm working. It's not ideal that they are eating during treatment, but she can be a little bit anxious in the stable at times, so it is nice that she can just relax and keep eating her hay while she accepts this body work, which is quite new to her. Just doing some deep cross fibre friction over that hard area, working up round the back of the scapular cartilage. And then just going the other way, almost working really crisscross through the tissue, really just making sure this tissue is soft and not stuck. We want this area pliable and able to move. And I'm just doing a gentle wither rock over the withers. There's a lot of muscle attachment here, so we just want to make sure that everything's moving and free. So here I'm just doing a simple scapula lift, and nothing comes from the lower leg, it does all come from the forearm there, so the lift came from my left hand. And then I'm working, having a palpate through the girth line there, down towards the girth box, just a long slow gliding movement. I do spend a lot longer doing more of a fascia release behind the triceps, but today this was more a massage technique, gliding through the tissue. When I'm doing a fascia release behind the elbow and through behind the triceps there, I can actually be there for up to 2, 3, 4, 5 minutes. Just working through the girth box. Obviously this can be an area of, there's a lot of fascia here, and obviously you've got to think about where our girths are sitting, etc., and where the damage can be done. So just working through any adhesions, just making sure everything's soft and supple and hydrated. Turning my hand back down, working back towards the pectorals, and then mid-thoracic's gliding back up. And then working superficially here, you've got your latissimus dorsi muscle. Deeper, you've got your serratus muscle, SVT, because it's the thoracic portion. And I find that it really just helps free things off through the thoracic sling here. Some good deep compression, as much as the horse will tolerate. And I'm just pushing through here, almost directly through the horse with my compression. The SVT here, serratus ventralis thoracis, is that like has a serrated edge, and it attaches to the first 8 or 9 ribs. Pulls the scapula down and back. And then I'll follow with quite a lot of vigorous fibre friction here. They seem to really enjoy this. And like I say, it really does help free up the shoulder and the thoracics there. Quite often I'll use my little blue tool called the Nobilit to do lots of cross fibre friction here. They do respond very well. Of course, you've got your saddle area, the rider's leg. There's a lot of stress and tension, and I just go and check. I'm always checking the tissue whilst I'm working.